Well, here's a business idea for the two of us. I say we start an app that educates people on apnea, and we call it Apnea. I mean,
It's a no-brainer.
I mean, it's right there.
It's right there.
How has nobody done this?
It's right there.
Apnea. Done.
It's a good one.
Look, you've touched on a couple of these things already, I think, but what are the most common, I guess, sleep disorders out there, and advice on how you would treat them?
Okay, so we can divide sleep disorders into three big ones. One are the parasomnias. Those are the weird things that happen: sleep eating, sleep talking, sleep walking, that kind of stuff. Difficult to treat, but can be treated. The two big ones are poor quality sleep, or what we'd call hypersomnia, and that's what we've spoken about: sleep apnea, but also restless leg syndrome and leg movements. Those are the two big disorders, organic disorders. The other big disorder is insomnia, which we haven't really touched on, which is people who battle to get the amount of sleep that they need.
Sure.
Now, the definition for insomnia is really that you get insufficient quantity of sleep. So we've spoken a lot about quality of sleep, but not so much about quantity. So if you don't get enough quantity of sleep to actually feel rested during the day, then that would be the definition of insomnia. Chronic insomnia is really simple, that you either have difficulty falling asleep, or waking up in the middle of the night and difficulty going back to sleep, or the very unfortunately termed terminal insomnia. It doesn't imply you're going to die, but you're waking up at 3, 4 o'clock in the morning and then you can't go back to sleep. So the end of sleep is disrupted.
That's me.
Okay, that for me is burnout, right there.
Adrenal fatigue.
Yeah, that's my personal symptom for burnout. When I start waking up at 4 o'clock, I go, cancel something, okay? Because you're doing too much. That's basically what it is. So it's that 3 times a week for 3 months, okay? That's chronic insomnia, right? And so the advice, if you want to give advice to people on what to do, if you wake up after having slept 7 to 8 hours but feel awful, you need to go tell a doctor that. Okay, that is what it is. You need to find out if you have a bed partner, do I snore? Do I stop breathing? Do I move my legs at night? Very simple questions, not hard. Partner says, oh yeah, you kick all the time, right? Or yes, you do snore. Yes, I've heard you catch your breath. That's perfect. My worst patients have bed partners who sleep well. And they go, oh, I don't know what's happening. I go, what use are you to me in this situation? Okay. So you speak to your bed partner or anyone who's shared a room with you and find out, is there anything strange you do during your sleep? Because that gives us somewhere to go. If you have insomnia, there are some things that you can do at home which would actually help a lot. So there's sleep hygiene, which is about don't drink coffee close to bedtime. We're talking 6 hours away from bedtime. Don't have a lot of alcohol at night. Try not to smoke all your cigarettes between 8 and 10 at night. That kind of thing. So just keep your sleep healthy. Try to do that. But if you find that you're battling to sleep, things that you can do is, if it's difficulty falling asleep, then please go to bed later. Because often what happens is that people who are battling to sleep, what they do is they go, I'll go spend longer in bed, because then I'll sleep longer. No,
Yes.
that doesn't work. If you need 6 hours and you spend 8 hours in bed, you will spend 2 hours awake. That is how the sun works. It's very simple. Now, that's 2 hours that the brain is planning to spend, but what we do is turn that into 4 hours of panic. Okay, so we extend that.
Yes.
So the question to ask yourself is, how much sleep do I need? And if you've had a sleep problem for a while, then go back a while. Like, how much did I need at varsity or when I was in my 20s? How much sleep did I need then? And if you got 6 hours, then you go down to 6 hours. Just cut your sleep down to 6 hours. And honestly, the biggest question I get asked when I tell people to do that is, what am I going to do? Like in those extra hours at night? Because they have created such a ritual about going to sleep, such an extended relaxation program, that their whole evening is about sleep, about getting ready for sleep. And now they have to think of something else. And I go, I don't care what you do up until an hour before you go to bed. An hour before you go to bed, stop, read a book, watch some TV, do something like that. So work. I don't care if you work. It's fine. Do that. If you're going to go to bed worried that you haven't done work, like do the work.
Yes, get it out of the way.
More likely to go to sleep, right? So, and by doing that, you increase your sleepiness. You make it much more likely to fall asleep.
Okay.
You also consolidate your sleep, so gaps in the middle of the night suddenly don't become gaps anymore because the brain is put under pressure to get the sleep in that piece.
Yeah.
It takes about 7 to 10 days for that to kind of come together properly, but right from the bat, it's easier to fall asleep.
So essentially creating a rhythm.
But creating a rhythm, but also squeezing up the sleep, like putting the brain under pressure. It's like us. If you have a free Saturday, you go, I'm going to get so much done, and you get nothing done. But if you have 3 hours, it's amazing how much you can get done in 3 hours if you have that to do. So it's the same with the brain. If you put it under pressure, it gets the job done. The other thing you do is do not lie in bed for hours trying to fall asleep. I mean, when you do it, you know it's not going to work. Like,
Yes.
you know that,
Yep.
but you don't know what else to do. And there's a sense of, I don't want to get out of bed because then I'm really awake. Well, here's the news. You're really awake already. All right? You're not going to be more awake. But when you lie in bed, the thoughts that go through your head, it's crazyville. Right?
Of course.
Catastrophize, you ruminate. You know, within 10 seconds, what can I do about the war in Ukraine? Nothing. There's nothing you can do. Okay. But that starts to worry you.
Yeah.
You know, everything starts to worry you, and then that keeps you awake. So it is much healthier to spend 15 minutes trying to fall asleep. If you don't fall asleep, get up. Go and watch some TV. Go and read. Go and do activities that are likely to put you to sleep.
Sure.
If you fall asleep on the couch, it's actually okay, because you prove to yourself you can go back to sleep, right? The bed's different, right? I have to fall asleep.
Yes.
The couch is, I'm just up because I can't sleep, right? There's no agenda. The minute there's no agenda, you're much more likely to fall asleep. So get up, do something else. When you feel sleepy again, because sleepiness will come back, when you feel sleepy again, go back to bed. And you're much more likely to go back to sleep.
We are so, we might be top of the food chain, but the fact that, like you just mentioned now, when you see the bed, there's an agenda. So your brain goes, oops, sorry, we're not sleeping today. The moment you go to the couch,
sleep.
yes,
Yeah.
exactly.
Mm.
Man,
So insomniacs will often describe how they fall asleep in front of the TV at 10 o'clock at night, but when they go to bed, they can't sleep.
of course.
Okay, that's a standard thing,
Yeah.
right? The other thing is we are the only animal that deliberately stops ourselves from sleeping. Okay? Cats and dogs, they just
Yeah.
sleep. It never occurs to them to worry about their sleep.
They just know that this
Yeah.
is what they need to
Yeah.
survive
And
the
if you
next
do
day.
those two things, it's called sleep restriction or bed restriction. Stimulus control, you're controlling this, the mind, from running, you're controlling that, and keeping a diary of your sleep has been shown to be the recommended treatment for insomnia. It's usually done by psychologists over an 8-session period, but you can do it yourself. These are not hard things to do.
Yeah.
They're not hard things to do. And over a period of 10 days or so, sleep kind of comes back. What's more important is that you get control over it. So you kind of go, it's predictable. I know when I'm going to sleep. I know that I can fall asleep. And I know that I can get the hours of sleep.
Yeah.
And that's what changes the whole kind of thinking process about sleep. You don't have to be anxious if you know you're going to fall asleep.
Of course. So, last question. Everybody knows that good quality of sleep, prepares you, like you feel ready the next day. So you're ready to take it on. Whatever challenge comes at you, you've got the rest, you've got everything you need, to take on the day. You've touched on it just a little bit here, but any practical examples? Like I've had a few, make sure your room is at a certain temperature, the colder the better, So any practical examples that you can give to people right now who feel like they're starting to sway a bit and they're not actually, setting themselves up for a good night's rest?
So there's certainly things that you mustn't do. So
Yes.
don't drink alcohol. Alcohol is a drug. It'll help you fall asleep. It's going to wake you up in 2 hours. That's how that works. Caffeine stops you falling asleep. So you want to take everything away from sleep that's likely to interfere with sleep. But people will say, for example, that TV is stimulating. I don't know about you. I don't get stimulated in front of TV. It is the most passive activity you can do.
True.
It's even more passive than reading a book. Because when you read a book, you are inventing the place in your head and the people. But when you're watching TV, you go, it's Tom Cruise. Like, there's no invention that needs to happen, right?
Sure.
It's there in front of you. It's an incredibly passive activity. Horror movies, different story. But if you're just watching TV, it's passive. You can watch TV because it allows you to just rest. What you have to do to fall asleep is I have this cartoon in my head always of the brain and the mind. They're not really two separate things, but they are in this, and the brain is this very biological thing. The melatonin is there, the length of being awake, so we've built up a whole lot of waste products that are trying to make us fall asleep, that very biological thing. And then the mind, which is the thinking part of our brain, which needs to be disconnected from this to allow this to happen. So it's about letting go, right? Allow this to happen. So you have to let this thing be on something else. So, I mean, people go, don't use screens, etc., etc. Yeah, don't use screens. If you're going to put a screen in front of your face, lots of light, and switch that off and expect to fall asleep, that's not going to happen.
Of course.
Because you have stopped your melatonin production until you switch that screen off. Your bedtime is now an hour and a half later. So give yourself at least an hour with no screens before you go to bed. Okay, that kind of thing. But if you go to bed and for 10 minutes you play Candy Crush just to disconnect your head, and that helps you fall asleep, that's not a problem. Does that make sense? Because
Does make sense.
It's just a little bit. Turn down the brightness on your screen. It's way too bright. They're always way too bright. Turn it right down because it's about amount of light. So reduce the light exposure that you have before you go to sleep. Take away anything you're eating and drinking that might interfere with sleep.
What is the gap? Sorry, very quickly. So should one be eating like an hour or two before?
Oh, at least 3 hours.
3 hours?
3 hours before you go to bed. Because one of the causes of snoring and sleep apnea is actually reflux, which can be silent, right?
Huh.
So remember, you take your body like this. Here's your stomach's down here, and your mouth is there where the apnea is happening, and you do that to it. Now things can slide up. Right? So acid kind of slides up, hits the back of your tongue, swells that up, and creates apnea. I mean, we've resolved snoring and apnea in people just by saying you cannot eat for 3 hours before you go to bed. Dinner has to be here. It has to be a smallish meal. Shouldn't be like a huge big meal. Smallish meal, and take a bit of Gaviscon before you go to bed.
Interesting.
Snoring, yeah. I told you, every single system.
Interesting.
Every single system. So yes, 3 hours away, don't eat a lot of spicy food. Don't eat anything that you know is going to give you indigestion, right? Don't eat a huge meal because you go to bed feeling uncomfortable. That's going to be an issue. But don't worry about cheese. Like, cheese doesn't give you nightmares. It just doesn't.
Except pap, though. You can eat pap. Pap will put you to sleep.
Pap will put you to sleep. But I've also seen some people serving of pap, and I've gone, no, like, that's too much. Okay?
It'll put you to sleep for 3 days.
Yes, exactly. Then there is bedroom environment. There's no question. So you need to be, and that goes in that same, be safe, be comfortable. Mm-hmm. I've seen a number of women who have got insomnia because they're not safe. Okay. Their husbands come home and start drinking. They go to bed super early because they don't want to engage with that. And they have insomnia because they're going to bed at 8. And I'm kind of saying to them, listen, the last time you slept from 8 until 6, you were 3 years old. Like, that's not normal, right? But I understand why you're doing it, but you can't sleep like that. And you're taking tons of medication to try and sleep like that because it's not normal, right? So you need to be safe, be comfortable. That's a personal thing, right?
Yeah.
I cannot sleep if I can feel air moving on my face.
True.
Okay, like there's an aircon in a hotel. I can't sleep if there's air moving. I can't sleep on a hard bed. Everyone goes, it's hard bed, good for your back. I wake up with sore hips and a backache every time I sleep in a different bed that's hard. So I prefer a soft bed. I prefer it warmer. I am terrible when it comes to winter. I have bed socks and double pajamas and a scarf, and because I can't sleep if I'm cold at all. But I do know other people who prefer.
I'm the opposite.
Yeah, windows open. They've got to feel that air. They've got to be cool. It's a personal thing, and you've got to find out what works for you, which may be different. Problem is, if you marry somebody who's completely opposite to you, then you have a problem. Mm-hmm. Okay. You also have a problem if you're a lark and you're genetically determined to go to bed at 9 and wake up at 4, 5, super happy and thrilled with life, versus somebody who's an owl like me who goes to bed at 11:30 and I'm happy waking up at 7. But don't speak to me for half an hour.
Okay.
Because it does, I have to engage. Like, do I really want to wake up?
Fair.
My daughter wakes up at 5. When I wake up at 7, she's up at 5. She's been to the gym, made a smoothie, had a shower, got ready. I'm like, I don't understand you.
Listen, Doc, this has been incredible. You know what? I would have loved while you were speaking, and it's not because you're boring or anything. It's just like just to fall asleep in this interview, right? And I'm sure you would have been, oh yeah, that's exactly it. You're probably the only person that would have gone, oh, you wouldn't have taken offense to that.
Not at all.
Well done. You've taken some of my practical examples and you just let go. But thank you so much for your time. I think that this is going to help a lot of people. I think a lot of times we look at sleep, and because it's such a normal thing that we all do, we don't take it as seriously as you are explaining right now. We don't put steps in place to help us get to that point, to get sufficient rest, etc., etc. And I think one of the biggest culprits is the hustle culture, the sleep when you're dead people, the while you're sleeping, we are doing this. Terrible. Please don't ever take that advice. That doesn't work for anybody at all. You will die.
Well, my response to that is, well, sleep when you're dead, that'll happen sooner than you think.
There we go.
Okay? And secondly, if you're hustling at 3 o'clock in the morning because you think you're better than the people who are sleeping, you're wrong. You are functioning at half speed. Okay? Whereas we Once we finish sleeping, we're going to be going at full speed, and we're going to catch up to you anyway.
There we go. Dr. Bentley, thank you so much for your time.
My pleasure.
I know that you've got people to put to rest right now. Ooh, that
Maybe
sounds
like an
terrible.
undertaker.
Oh, yes. Technically, you're an undertaker.
Not. It's reversible sleep. Okay, it's reversible.
We are still going to talk about apnea.